Strategic family therapy is the topic of Chapter 14. Some of the objectives include discussing the role J. Haley played in promoting strategic as well as structural therapy, exploring some of the major tenets of strategic family therapy approaches, and looking at the uniqueness of the approach. Strategic family therapies are method-oriented and brief in duration. They're influenced by the work of Milton Erickson. The three distinct branches of strategic family therapy include the strategic family therapist of the Mental Research Institute, the strategic family therapist of the Family Therapy Institute, including J. Haley, and the strategic family therapist of the Milan Institute. The strategic family therapy's influence of Milton Erickson. The term strategic therapy was coined by J. Haley to describe the work of Milton Erickson. Milton Erickson was especially attuned to the power of the unconscious mind as a creative, often positive, solution-generating entity, paid particular attention to details of the symptoms his clients presented. Milton Erickson achieved his objective in therapy through the following procedures: accepting and emphasizing the positive, using indirect and ambiguously worded directives, encouraging or directing routine behavior so that resistance is shown through change and not through normal and continuous actions. Some of the major strategic theorists include Paul Watzlawick, John Weakland, J. Haley, and Cloé Madanes. J. Haley learned hypnosis from Erickson in 1953, incorporated much of Erickson's ideas into his own concepts about how to do therapy. He was the first editor of the initial journal in the field of family therapy called Family Process, and he helped to organize the Institute for Family Counseling. Cloé Madanes was born and raised in Argentina. She was gentler in her approach to strategic family therapy than Haley. She developed the pretend technique, and one of her lasting contributions was in the areas of sex and violence. The premises of the theory follow many of Milton Erickson's principles. They emphasize short-term treatment of about 10 sessions. No one evaluates which solutions have so far been attempted for the patient's problems, and it concentrates on 7 dimensions. Dimensions of therapy include family rules, the overt and covert rules families use to govern themselves; family homeostasis, the tendency of the family to remain in its pattern of functioning unless challenged to do otherwise; quid pro quo, the responsiveness of family members to treating others in the way they are treated; and the redundancy principle, fact that a family interacts within a limited range of repetitive behavioral sequences. Punctuation is the idea that people in a transaction believe that what they say is caused by what others say. Symmetrical relationships and complementary relationships, fact that relationships within a family are both among equals, symmetrical, and among unequals, complementary. Circular causality is the idea that one event does not cause another, but that events are interconnected and that the factors behind a behavior are multiple. Treatment techniques. Reframing involves giving a different interpretation to induce a cognitive shift within family members and alter the perception of a situation. Directive. Instruction from a therapist for a family to behave differently. For example, nonverbal messages such as posture and silence. Direct and indirect suggestions, saying something like, go fast. Assign behaviors. When you think you won't sleep, force yourself to stay up all night. Paradox, similar to prescribing the symptom, gives a client families permission to do something they are already doing and is intended to lower or eliminate resistance. Restraining, telling family they are incapable of doing anything other than what they are currently doing. Prescribing, instructing families to enact a troublesome dysfunctional behavior in front of the therapist. Redefining, attributing positive connotations to symptomatic or troublesome actions. Ordeals involves helping the client to give up symptoms that are more troublesome to maintain than they are worth. Pretend involves asking family members to pretend to engage in a troublesome behavior such as having a fight or to imagine that something is disconnected so they do not have to respond to a stimulus. Positioning, acceptance and exaggeration of what family members are saying. Role of the therapist. The first task is define a presenting problem so that it can be worked on and solved. Most are overtly active. Use presenting problems as a way to bring about change in families by giving the tasks that are usually carried out between sessions. The goal is to resolve, remove, and ameliorate the problem on which the family agreed to work. 4 common procedures for ensuring a successful outcome include defining a problem clearly and concisely, investigating all solutions previously tried, defining a clear and concrete change to be achieved, formulating and implementing a strategy for change, focusing on changing vicious cycles to virtuous ones. Some unique aspects include flexibility, the belief that real change is possible at the individual and dyadic level, focusing on innovation and creativity, the way it can be employed with a number of other therapies, particularly behavioral and structural therapy. So once again, this approach is very flexible in nature. There are a lot of great applications, and it can be very beneficial to families.